Hi everyone, this is Heartburn topic part 1, and today we're going to be talking about heartburn causes. First of all, what is heartburn? Heartburn, also called pyrosis, is this burning sensation felt in the middle of the chest behind the breastbone or sternum. Some individuals describe it as fiery sensation or chest on fire. And despite its name, it has nothing to do with the heart. It's a problem related to the digestive system. Maybe it's called so because sometimes it's mistaken for heart attack pain. Anyways, this burning pain gets worse when you bend over or lie down. It does happen when stomach acid refluxes or backs up into the esophagus, which is the food pipe that connects your mouth to your stomach. This backward flow of stomach acid into your esophagus is called acid reflux. So, what are the causes? First, bear in mind, occasional heartburn happens to nearly everyone at some point in life. It's a fairly common problem and no cause for concern. However, frequent or persistent heartburn can be a symptom of many different conditions. And the first condition we're going to talk about is a chronic acid reflux, known as GERD or gastroesophageal reflux disease. It's a condition in which stomach acid persistently shoots up or backs up into the esophagus. And why it does so? It's because there is a valve at the end of the esophagus. This valve is called the lower esophageal sphincter and is composed of smooth muscle. Normally, it closes when food arrives at your stomach to keep it in there. However, in GERD, it's not as tight as it should be. So acid flows back up into the esophagus, giving that painful burning sensation in the middle of the chest. Another condition that might weaken the lower esophageal sphincter and cause heartburn is hiatal hernia. In this condition, part of the stomach bulges up into the chest through a weakness in the diaphragm, which is the large flat muscle that separates the lungs from the tummy or abdomen. And we have two types of hiatal hernia, sliding hiatal hernia and paraesophageal hiatal hernia. The sliding type is the most common type. In this case, the lower esophageal sphincter and the top of the stomach protrude through hiatus, which is a hole in the diaphragm through which the esophagus comes to join the stomach. The second type of hiatal hernia is paraesophageal hiatal hernia, also known as rolling hiatal hernia. In this case, part of the stomach pushes up in the diaphragm next to the esophagus. The next disorder we're going to talk about is gastroparesis. It's a disorder that prevents the stomach from emptying food properly as it affects the normal spontaneous movement of the muscles in the stomach. This means that the stomach's motility is slowed down or doesn't work at all. So in this case, food stays in the stomach longer, increasing the risk for heartburn. Sometimes heartburn can be a side effect of certain medications. Many different medicines can trigger heartburn or make it worse by either irritating the esophagus or making the lower esophageal sphincter more relaxed or weaker. So you may need to check with your healthcare provider about any prescribed or over-the-counter medicine. Also, stress and lack of sleep can increase the amount of acid your stomach makes, which leads to heartburn. Furthermore, it's common for pregnant women to experience heartburn. This is due to the growing baby pressing against the stomach. On the other hand, it's due to pregnancy hormones that can relax the lower esophageal sphincter so it doesn't close as it should, which causes the stomach content to move up into the esophagus. In addition, both smoking and alcohol are known to cause heartburn. They decrease the lower esophageal sphincter's ability to function properly and prompt stomach to produce more acid. Also, anything that puts too much pressure on your stomach can lead to heartburn. This includes obesity, constipation, wearing tight-fitting clothing around your abdomen, etc. Such pressure can force food against the lower esophageal sphincter, causing stomach acid to back up into the esophagus. Eating large meals or eating too much at once can put extra pressure on the lower esophageal sphincter and lead to heartburn as well. Similarly, eating too close to bedtime can trigger heartburn if the body is still digesting a lot of food when you lie down. Moreover, be aware that some types of exercise, especially high-impact exercise or workouts, can trigger heartburn. Likewise, exercising on full stomach can actually be a heartburn trigger. So it's important for heartburn sufferers to know what type of activity is suitable for them and when to do it. Next, heartburn can be triggered by certain foods and drinks. How? Well, some of them can make your stomach produce more acid. Some others can lead to a lazy, relaxed lower esophageal sphincter, and some foods can do both. And there are cases where it's unclear how certain foods lead to heartburn. However, keep in mind, when it comes to foods and drinks as triggers, they're not the same for everyone. They differ from person to person, okay? Now we're going to go over the most common triggers. They include fried and greasy foods, spicy foods, high acidic foods such as citrus products and tomato sauces, especially if you eat them by themselves or on an empty stomach. Chocolate is another common trigger for heartburn. Types of mint, including peppermint and spearmint, may cause heartburn in some people. Onions and garlic, especially raw, can also be culprits. And last but not least, many people find that caffeinated and carbonated beverages can provoke their heartburn. Heartburn can also be caused by low levels of stomach acid. This is known as hypochlorhydria or echlorhydria. Hypochlorhydria is too little stomach acid, while echlorhydria is the absence of stomach acid. Both conditions can impair the digestion process and lead to heartburn along with other symptoms. They can arise due to several conditions and a variety of factors. We're going to just mention some of them. They include hypothyroidism, pernicious anemia, H. pylori infection, certain autoimmune disorders, the gastric bypass surgery for weight loss, stomach cancer, and overuse of medications used to block stomach acids such as antacids and proton pump inhibitors. To summarize, heartburn is an uncomfortable burning feeling in the chest and is often linked to weakening or relaxation of the lower esophageal sphincter, which leads to stomach acid backing up into the esophagus. It's common for people to experience occasional heartburn without being cause for concern. However, frequent or persistent heartburn can be caused by many different factors and conditions to be aware of.